Hi everybody, Dr. Samantha here, and today we're going to be talking about the benefits of pregnancy chiropractic care and just what is that Webster technique. If you've been part of our little community here, you might have heard of the Webster certification or being Webster certified or the Webster technique. We'll be talking about what is that and how does it play its role in the pregnant chiropractic care. So we've been seeing a lot, and like what kind of brings me to what webinar do I want to do next. It's kind of just a lot of the things that have been going on within the office, and lately we have been seeing a ton of pregnant women. It makes my heart so happy and so full to see these women and to see like everything that they're going through and just to be part of this journey with them. It's a complete honor. And another reason why I wanted to do this webinar is, yes, I have the ones in my office now and they understand it and they get it and they're there and they know. But I have a lot of women that go, oh my gosh, whenever they're in there, they're like, I wish I would have known sooner. I wish I would have known that, you know, chiropractic can help so much with my pregnancy for the first 3 kids that I have, because this one just seems to be going like a breeze. I do have a lot of women that they're like, we didn't even know. I had no clue that chiropractic could have such an impact on my pregnancy and then therefore my labor and delivery, and then also even postpartum. So just want to bring that to the surface here and talk about it today. So the things that we're just going to be going over is, you know, just some of the benefits of it, why, what's going on, what, you know, like I say, what are the benefits, what kind of relief can I get, and then also be talking about what that Webster technique is. So to start off with some of the benefits, moms have just said that they feel good. They feel so much better. Whenever you are pregnant, you are literally developing a human, and so your body's just going to go through so many transitions and so many changes, and you just might not feel the best. And with those changes, the body is just constantly adapting, and that's one thing as a chiropractor with working with pregnant women, we get to watch and see that body ever changing and adapting, and then kind of almost be ahead of it. So be kind of like proactive versus reactive in the alignment of their body, and we'll get into like alignment here in just a second. But a lot of women just say like they feel so good underneath the care while they're going through their pregnancy, because a lot of times we're going to get a lot of that shoulder and neck tension because we have a lot more weight that's being transitions toward the front. Along with that, a lot of women notice obviously low back pain, sciatica, just because all of our weight distribution is taking a huge shift forward. So everything along the back side of our body is having to kind of hold on and be a little bit stronger and maybe go through a little bit more tension. So they feel, just like I say, overall better in the neck pain, low back pain. Some women, they get that, what we call the pubic symphysis kind of like discomfort, and so that's within that, like, excuse my French, but I've been heard that it's called like lightning crotch. I've never had a baby, but from the women, all the women that I've worked with, they're like, oh my gosh, like it just feels like this horrible shooting pain. Some women feel like it's just this horrible like aching, like just heavy dispensed pain. So yeah, just like that pubic symphysis pain. And then also, you know, like with that, there's just so much tension and pressure that they start to feel. This will kind of be later on into their pregnancy journey, but that's what the benefits of having chiropractic so early. We can be on top of that pelvic alignment, which again, we're going to talk about here soon. But we can be on top of that pelvic alignment and maybe help that pubic symphysis stay in a little bit better position for them. Things that women also talk about, just like feeling better. You know, like there's a lot of women that start to say like, oh my gosh, like I can't even just like roll over in bed. I can't get comfortable. Getting in and out of the car is a complete chore and challenge. And those are just the things that they start to say like, wow, like my body just feels so much better. So these things are actually a little bit better for them and easier for them with less pain. Number 2 that we're going to move on to is mama energy. So we could all use energy, but especially these new moms. Like I say, you are developing a new human within you, and so it takes a lot of energy and it takes a lot of extra effort from your body. And so with that, we like to kind of release the stress, release the tension, and so then you're able to, you know, put more energy towards carrying, towards developing that human. With mom energy, you need a lot more sleep. because like I say, with the growing, with the ever changing, your body just might fatigue faster. So we want to be able to have good sleep, and that's going to obviously give us more energy. And another one is just like it prepares then your body, like we want to prepare your body for labor and delivery. You're going to be doing pretty much what would be like a marathon or an ultra marathon whenever you think about the time frame with labor and delivery. It can be anywhere from 6 to 24 to 48 hours that you're doing this. And if you don't have the energy built up even during your pregnancy, how do you expect your body to perform whenever it needs to during that labor and delivery moment and have the energy that it needs to push through that? And so with chiropractic, that's where we are able to give women a lot more energy and let their energy reserves go towards, you know, healing, developing, growing, versus kind of being in that reactive mode. Another one, the number 3 that we'll move on to, is with chiropractic, we're able to see a lot of women, like we're able to decrease the amount of worry, stress, and anxiety during this time. Whether it's your first one or your third or your fifth or your sixth, there always comes a different level of worry, stress, and anxiety. If it's your first one, you have no idea what to expect. If it's your third, fourth, fifth, you're starting to wonder, how am I going to transition, you know, with all the other little kiddos that I have, and, you know, be able to be that mom for all of them. So it kind of just, it's one of those things with the worry, stress, and anxiety. As a prenatal chiropractor, you then have someone else that's on your team, and you're able to bounce things off of. You're able to get more information from. You just become this more, you know, wealth of knowledge yourself just by having that other person on your team. That way you're then able to, you know, feel a little bit more empowered. And that's just kind of the beauty with decreasing, sorry about the siren there, decreasing that stress, worry, and anxiety. Number 4 that we're going to move on to is pelvic alignment. So this one might be like, you know, obviously other than like the pain, the back pain, neck pain, and stuff like this one's kind of like really cool, and how this can all start to piece everything together. So whenever we have more better pelvic alignment, we are dealing with the bones, the ligaments, and muscles. And so whenever we are pregnant, we have all of that down within there. There's going to be constant shifting, constant turning. As you can see, if those muscles, like if each of my fingers had a muscle or ligament attached to it, and each time the bone moved, there's going to be a little bit more torsion, a little bit more stress, a little bit more pressure on those muscles and ligaments. And those are the things we're wanting to find balance. We're going to keep all those things balanced, because the second we go out of balance, other things are going to start to flare up. So if we have a little bit more, if the pelvis is a little bit out of alignment here, we don't have that balance that we need to allow for that nice roomy area for the baby to be growing and being housed in, and then therefore allowing, like I say, the decrease of pain and pressure that we get from having imbalances within our pelvis. Because with decreased torsion and decreased tension, we're going to then also have decreased fatigue. So we just talked about that mama energy. The less tension, the less torsion that we have within that pelvis, the more energy that we're going to have, because it's not having to fight that constant battle and so then if the body's kind of already fatigued from the pelvis being out of alignment, that's not what we're going for. We want to keep that energy going. We want to keep that energy almost housed in there, versus it letting it get fatigued and get tired. So by the time labor and delivery comes, your uterus isn't sitting there going, you want me to do what now? Like, I have been stressed and I have been pulled and I have been tense for the last, 9 months, not technically because it doesn't happen that soon, but like the last 5 months. And now you want me to do what during this labor and delivery? I don't have the energy. I don't have the oomph for this. And so that's where it's the hugely important with pelvic alignment. Also with pelvic alignment and talking about that uterus, the uterus is an organ that is primarily just all muscle. And so it has the ability then to obviously stretch and contract, because that's where we get our contractions. And so if you think about the pelvis being out of alignment and there being imbalance within it, think about your bicep muscle. If you had it in like a constant tense, like even if you had it contracted or extended, and like extended even against like resistance. So if you're to press down against your arm, even though it's not contracting this way like we think about with the contraction, if we have it out and you apply just a pressure onto your hand and then press down with this hand and up with this hand, you can feel that tension. And so if that uterus has that constant we like to influence the tone within the uterus. We want it to be a nice relaxed tone versus that tensed up tone. And so you'll hear a lot of times, if you become a patient or if you're a current patient, we want to like just help with the tone of that uterus, because it is a muscle and it's preparing for a huge event. And so we just want to keep the tone of it nice and relaxed, nice and free, and nice and giving. Excuse me. And so we just want, just want that thing to be ready, be prepared for labor and delivery. We want it to be able to have the energy that it has, the correct tone within it. So whenever it's time to go, it is functioning at its best. It is functioning optimally. So that's the thing with pelvic alignment. And like I say, all of this then kind of with the pelvic alignment just helps with the sequencing of labor and delivery. So whenever it comes, it is go time and pelvic alignment is right. That then actually helps with the positioning of the baby. And so we have our cervix down there. And it's like if the pelvis is aligned properly and there's no torsion with it or anything like that, that baby's able to be like, okay, yes, head coming down, here we are, and we're now applying pressure to that cervix, which is actually hugely important for like I say, the beginning sequencing of that labor and delivery process. And so once that head has, of the baby has met that cervix and applies the correct pressure, that allows for, all of that sequence to happen in the way that it hopefully should. Now, many times there are times that that doesn't happen, and that's just the way that it goes. But we're able to influence that in a manner to help this process go as naturally as humanly possible. So then that way it's the labor and delivery that mama had maybe hoped for. So there is that part. And another thing, the last thing that I'm going to kind of wrap up here would be just having another person on your birth team. You obviously have your doctor, your midwife, maybe a doula, but even like I think a lot of them even do like birth hypnosis and like kind of to help your mind get right and your mindset get right. But just as a perinatal chiropractor, we want to be another person, like you say, on your team. I take a lot of pride in empowering women, educating them, so that yes, sometimes pregnancy isn't roses and dandelions, but we're able then to be there, and if it isn't going the way that you want, we're able to then help your body function the best that it can, but then also just be another sounding board for you. It takes, like you might say one thing to one doula and another thing to another doula, and you'll get two maybe totally different answers, and that's okay. But just finding more avenues, more people to be on your team to allow this process just to be, like I say, decreasing the worry, stress, and anxiety of it, because then that also then just helps the tone within our entire body, and it just, you just feel more empowered. And the more you know, the more you ask, and like having another person, have another set of ears, another set of eyes, and another, mind to help you through this process is a wonderful thing. And just like I say, just having women feel empowered is like one of my ultimate goals. And this is just where, as your prenatal chiropractor, that I could come in, and that's where, where we kind of get our excitement from, is helping these women transition during this time. And like I said, and giving women the confidence during this time, and allowing them just to trust like their mama gut, or their soon to be mama gut, and getting that balance of what feels right, what doesn't feel right. So whenever labor and delivery, and then even postpartum time comes, you just feel like you got this, you're ready to roll. And even though it's going to throw you a curveball every now and then, you just feel like you have it a little bit more under control. So that's that. Moving on to what is this Webster technique. There are chiropractors out there that we go through a lot more certification to work with pregnant women, and that technique is the Webster certification technique. And it is one of those, whenever you're searching for like a prenatal chiropractor, just to be sure that they are Webster certified and that they work with a lot of pregnant women. So they've had, the experience, the know-how, and just, been around a lot of them, and that just is only going to, benefit you. With the Webster technique, and I'm actually going to read like the exact definition of what it is. It is a technique of specific protocols to adjust the sacrum, which is the very, very low, like your tailbone, to adjust the sacrum, facilitating pelvic alignment, and as well as good nervous system function. And so we talk about alignment. We didn't really touch base on much of the nervous system today, but that's what, as chiropractors, what we do and what we influence the most is we allow that nervous system just to function the absolute best that it can. So then there is good communication from the brain to your body, to your pelvis, to the uterus, to the baby. And this, like I say, becomes a great part of that sequencing that we had talked about. Within that technique, there's also balance within the, and I'm just looking at my notes, balance within the pelvic muscles, ligaments, and that allows for that decreased torsion. So torsion, we like to think of twisting and turning. That is what we want within that pelvic area, and that's what we don't want within that uterus. We want that just to be nice, smooth, and relaxed. And so like they say, then therefore, if we have decreased torsion, that allows for optimal baby position that we just talked about, and as well as an optimal labor and delivery outcome. So like I say, it's just helping, you know, prevent so much, influence so much in a positive manner to allow for all of this whenever the big day of labor and delivery comes, that can go the best that it absolutely can. Mama has more energy, mama has less pain, mama has less stress, worry, anxiety, mama's pelvis is in proper alignment. It all just becomes like this beautiful, well-rounded situation that we have, and it's an awesome one. And so that's just where, with the Webster technique, how we influence and how we work with women who are expecting and allow for that process to be the best that it can. So like I say, I love working with these pregnant women. It's a huge passion of mine, and especially just to be on their journey. Like I say, I have one right now, she's on her 5th one, and she wants this one to be the best. You know, she hadn't even heard of chiropractic can help with the being pregnant, and she's so excited for it, and I'm excited for her. And it's just a neat thing to see this transition happen, this process happen, and I couldn't be more excited to be part of it. If you have any further questions, please don't hesitate to reach out to me. I'm here to help, and you can reach me at at sjlwellness@gmail.com or at 402-432-7702, and I would be happy to help with any questions that you might have, any questions, concerns, anything like that. Thanks for listening today, and enjoy your day.